New U.S. rules to deny green cards to many legal immigrants. Washington. The Trump administration announced Monday it is moving forward with one of its most aggressive steps yet to restrict legal immigration, denying green cards to many migrants who use Medicaid, food stamps, housing vouchers or other forms of public assistance. Federal law already requires those seeking to become permanent residents or gain legal status to prove they will not be a burden to the U.S. a public charge. In government speak, but the new rules detail a broader range of programs that could disqualify them. And the continued separation of migrant parents from their children. The new rules target people who enter the United States legally and are seeking permanent status. Trump administration rules that could deny green cards to immigrants who use Medicaid, food stamps, housing vouchers or other forms of public assistance are going into effect, one of its most aggressive moves to restrict legal immigration. August 12 would scare immigrants away from asking for needed help. And they voiced concern the rules give officials too much authority to decide whether someone is likely to need public assistance in the future. The Los Angeles-based National Immigration Law Center said it would file a lawsuit, calling the new rules an attempt to redefine the legal immigration system in order to disenfranchise communities of color and favor the wealthy. And David Skorton, President and CEO of the Association of American Medical Colleges, said, the consequences of this action will be to potentially exacerbate illnesses and increase the costs of care when their condition becomes too severe to ignore. This change will worsen existing health inequities and disparities, cause further harm to many underserved and vulnerable populations and increase costs to the health care system overall, which will affect all patients, he said in a statement. Cuccinelli defended the move, insisting the administration was not rejecting long-held American values. Pressed on the Emma Lazarus poem emblazoned below the Statue of Liberty that reads, "Give me your tired, your poor, your huddled masses yearning to breathe free," he told reporters at the White House. "I'm certainly not prepared to take anything down off the Statue of Liberty." At the southern border, with nearly two-thirds of Americans 65% saying the federal government is doing a very bad or somewhat bad job, the survey found broad support for developing a pathway to legal status for immigrants living in the country illegally. On average, 544,000 people apply for green cards every year, with about 382,000 falling into categories that would be subject to the new review, according to the government. Guidelines in use since 1999 refer to a public charge as someone primarily dependent on cash assistance, income maintenance or government support. Under the new rules, the Department of Homeland Security has redefined a public charge as someone who is more likely than not to receive public benefits for more than 12 months within a 36-month period. If someone uses two benefits, that is counted as 2 months. And the definition has been broadened to include Medicaid, housing assistance and food assistance under the Supplemental Nutrition Assistance Program, or SNAP. Following publication of the proposed rules last fall, the Homeland Security Department received 266,000 public comments, more than triple the average number. It made a series of amendments to the final rules as a result. For example, women who are pregnant and on Medicaid or who need public assistance will not be subject to the new rules during pregnancy or for 60 days after giving birth. The Medicare Part D low-income subsidy also won't be considered a public benefit. And benefits received by children until the age of 21 won't be considered. Nor will emergency medical assistance, school lunch programs, foster care or adoption, student loans and mortgages, food pantries, homeless shelters or disaster relief. Active U.S. military members are also exempt, as are refugees and asylum seekers. And the rules will not be applied retroactively, officials said. Green card hopefuls will be required to submit 3 years of federal tax returns in addition to a history of employment. If immigrants have private health insurance, that will weigh heavily in their favor. Of census data, low-income immigrants who are not citizens use Medicaid, food aid, cash assistance and Supplemental Security Income, or SSI, at a lower rate than comparable low-income native-born adults. Non-citizen immigrants represent 6.5% of those participating in Medicaid and 8.8% of those receiving food assistance. The new public assistance threshold, taken together with higher requirements for education, work skills and health, will make it more difficult for immigrants to qualify for green cards. Advocates say. Thank you for watching. Please subscribe.